How to appeal an adverse benefit determination. Imagine getting a notice that your health plan or Medicare has denied coverage for a service you really need. That can feel frustrating, but you do have options. Let's walk through how to challenge that decision and stand up for your healthcare rights. First, carefully read the denial notice. It will explain why your claim was denied and give instructions on how to appeal. This notice might be called an explanation of benefits or a Medicare summary notice. Next, gather any supporting documents from your healthcare provider. Medical records, notes, or letters explaining why you need the service can strengthen your case. Once you have your information, check the deadline to file your appeal. Usually, you have between 60 and 180 days from when you get the denial notice. Missing this window can limit your options unless you have a good reason like illness or disability. Then, decide what type of appeal you need. If your situation is not urgent, a standard appeal is fine. But if waiting could seriously harm your health, ask for an expedited appeal. Your healthcare provider can request this if they believe delay would be dangerous. To file your appeal, follow the instructions in your denial letter. You might need to fill out a specific appeal form or write a letter explaining why you disagree. Be sure to include your Medicare number, personal details, and any supporting documents from your provider. Send everything to the address listed in your notice. For original Medicare, there are 5 levels of appeal. The first is redetermination by the Medicare administrative contractor. Next is reconsideration by a qualified independent contractor. If needed, you can request a hearing before an administrative law judge, then review by the Medicare Appeals Council, and finally, a court review if the amount in dispute is high enough. Medicare Advantage plans have their own appeal process, but they must give you clear instructions. Keep copies of all your correspondence, forms, and documents during the process. If you need help, reach out to state health insurance assistance programs, Medicare counselors, or legal aid organizations. Respond quickly to denial notices to protect your rights. Use your provider's support to explain why the service is necessary. Remember, appeals are only for contesting coverage or payment issues, not for filing complaints. If your appeal is denied at one level, you can usually move to the next. If your health needs are urgent, ask for an expedited appeal to avoid delays. Following these steps can help you challenge unfair decisions and keep access to the healthcare services you need.